NCLEX previous year question and answer discussion. The question number 1, a boy who 4 years old began to use the curse word and concerned about this behavior. Parents are concerned about this behavior. The baby boy used offensive language, and his parents asked to the nurse how to discourage it. What advice should the nurse offer? There are 4 options. Which one is the best one? Number 1, just ignore it. He will grow out of it. Number 2, tell him it is not acceptable and he will be uh, disciplined if he continue to do it. Number 3, tell him that good little boy do not use any offensive word, and tell him that his behavior makes you angry. So sometimes when we work in the hospital, we face some same type of problem. Sometimes patient can throw any offensive word. What are the first priority or first steps? We tell them it is not acceptable. So number 2, tell the boy it is not acceptable and he will be disciplined if he continue to do it. What is the rationale? The nurse should advise the parents to tell him it is not acceptable because by explaining their objection and expectations, the parents educate or teach the child why the behavior is unacceptable. A good motivation explanation can help and correct this boy and helps him to understand that he must stop it. And telling the parents to ignore the behavior or telling the child the behavior makes the parents angry would not teach the child that his behavior is inappropriate, or advising the parents to tell him, good little boy, do not use the offensive word would reinforce the impression that the child is bad or diminished his self-image while doing little to change the objectionable behavior. Question number 2, a 17 years old adolescent who diagnosed by acute lymphocytic leukemia and is discharged with the written information about the chemotherapy and administration and his outpatient appointment schedule. He now is in the maintenance phase of chemo, but he missed the clinic appointment for blood work and admin to omitted some chemotherapy doses. To improve his compliance, the nurse should include which intervention in the care of plan. So 17 years adolescents diagnosed with leukemia, right? What kind of leukemia? Acute lymphocytic leukemia. So leukemia Actually cancer, and cancer that causes an increase in production of immature white blood cell that infiltrate the organ or tissue in the body. And most common cancer in childhood, acute lymphoblastic leukemia. Usually patient present with fever, bruising, pallor, GI upset, unsteady gait, and in the late stage, patient present with pain, hematuria, mouth ulceration, or increased intracranial pressure. So in case of leukemia, how we diagnose it? We diagnose it by bone marrow aspiration or lumbar puncture, CSF analysis. So this patient, 17 years old, acute lymphocytic leukemia, treatment is chemotherapy. What are the other treatment options? Radiation or stem cell transplant. So in our patient has a chemotherapy, and this patient unfortunately forget the schedule. Now, what will we do? So admit to omitting some chemo to improve his compliance. The nurse should include which intervention? One, emphasizing the long-term consequence of non-compliance, or adolescents for failing to complete his treatment, or letting the adolescents participate in his planning and scheduling treatment, and threatening to discontinue care if does not comply. Definitely number 4 is not a answer. It is not ethical, right? We have to follow the principle of ethics. And also we will try to involve the patient to the planning or caring by themselves, make them dependents upon them. So what are the best option? So it is good you help your patient adolescents participating to maintaining his planning and scheduling for the treatment, right? So what is rationale? Because the adolescence is want to be independence, or healthcare provider should promote health self-reliance whenever possible, such as by letting him participate in planning or scheduling his treatment. He can help the establish a realistic goal and evaluation outcomes, as well as help schedule procedure, and chemotherapy does too minimize the lifestyle disruption. Adolescents are oriented in the present and have relatively little concern for long-term consequence of their behavior. Before to go next question, I want to share with you, when any patient diagnosed by leukemia and patient undergo the treatment option chemotherapy or radiotherapy, as a healthcare provider or as a RN or LPN, we have to educate our patient, or chemotherapy care and teaching is important, right? So if our patient take chemotherapy, they have a chance to develop some side effect like nausea, vomiting, GI upset, loss of appetite, mouth sore, hair loss, fatigue, and pancytopenia. Why pancytopenia? Pancytopenia because bone marrow depression and resulting in anemia, neutropenia, or thrombocytopenia. Anemia means decrease the red blood cell and patient symptom with fatigue and shortness of breath. Neutropenia means decrease the white blood cell and causing increase the risk of infection, patient develop fever. Thrombocytopenia means decrease in platelet count, causing and increase the risk of bleeding. So what are the focus of teaching about the care of the patient? If patient complain nausea and vomiting, we provide antiemetics prior to administration. We provide small and frequent meal, also involve the child in their meal planning. Actively participate their daily living activities. Mouth sore and care is important. We provide the soft toothbrush and soft non-acidic food. We provide frequent oral care. Also, lubricate the lips and lip ointment we use. If patient develop infection, tell your patient to avoid public place, overcrowded place, avoid fresh fruits, avoid fresh vegetables, and also maintaining good hand hygiene. Also, scan visitor for infection. If patient complain of bleeding, tell to avoid invasive procedure. Avoid non-steroidal anti-inflammatory medication, avoid aspirin. Also, if bleeding, tell to use the soft toothbrush, also monitor for the bleeding. So what next? Next question, a mother tell the nurse that her 4 years old child is very poor eater. What is the nurse best recommendation for helping the mother increase her child nutritional intake? There are 4 options. Which one is the best option? Number 1, allow the child to feed herself or himself, or use specially designed food for children, or only serve the child favorite food, allowing the child to eat at a small table and chair by herself. So out of 4 years old child, right, they are preschooler. So nutrition intake is important. So we educate them how to take the food by themselves. So allow the child to feed themselves. What are the explanation? The best recommendation is to allow the child to feed herself, because the child stage of development is the preschool period of initiative. Special food would improve the primary recommendation, but would not be an effective approach on their own. It's important to offer the new food or new choice, not just the severe her favorite foods. Using a small table or chair would also improve the primary recommendation of allowing the child to feed herself. But first choice, first priority, allow the child to feed herself because the child is 4 years old. It is the preschool age group. Another question, the ABCD. ABCD method offer one way to assessment the skin lesion for possible skin cancer. What does A stand for? What does B stand for? What does C stand for? What does D stand for? But whatever, every alphabet stands for something. Like D stand for diameter, C stand for color, B stand for border, A stand for what? Extrinsic or asymmetry, ARCAS assessment. A stand for asymmetry, right? So in this picture, we can see different skin lesion. Let me read the rationale. When following ABCD method for assessing or assessment the skin lesion, like this picture, A stand for asymmetry, B stand for border irregularities, C stand for color variation, and D stand for diameter. So as an example, I'm saying this is the macules, this is papilloma, this is plug, papules, petechia, and purpura. This is scaly, telangiectasis, vesicle, and wheel. So every skin lesion, different size, different color, different diameter, different border, and symmetriness. As an example, this one, it is the border, outer area. Is it regular or irregular? If it is irregular, chance of malignancy. Is it symmetry in all areas? And what are the diameters? And what are the color? Definitely the scaly and this vesicle is not same color, right? What else? Here, A stand for asymmetry. This is the skin lesion. One half does not match with the other half. Border, is it regular or irregular? Uneven or even? Uneven border indicate malignancy. And system for color variation. Variety of color like brown, tan, black, papules, brown, and diameter grows larger than the size of a pencil. Or last one, E, evolution, change the size, shape, color, also elevation, another trait for new symptom. Next question. At 15 weeks gestation, a client is scheduled for serum alpha fetoprotein. So a mother is pregnant and it is 15 weeks. and scheduled for serum alpha fetoprotein test. AFP or serum alpha fetoprotein, a special type of protein in serum, it indicates normal or abnormal, more than normal or more uh, more than normal or less than normal range. Both is bad, either Down syndrome or spina bifida. So which maternal history finding is the best explain the need for this test? So if anybody has a family history of Down syndrome or neural tube defect, what is called spina bifida, it is indicated, go for the test. My baby who is coming have any problem or not? Number one, family history of spina bifida in a sister. Family history of Down syndrome in a father side. But this question for already tell the maternal history. So number two is not a choice because it is talking father side. History of gestational diabetes during previous pregnancy and history of spotted during the first month of the current pregnancy. So number three and number four is not an answer because it is not related to alpha fetoprotein. Number two is not an answer because question say which is maternal history, but number two is a paternal history. So one is remaining. Spina bifida. So in this picture, we can see this is the spinal cord. Spinal cord supposed to be continue up to the chorda tendini, but unfortunately, this is bulging to outside. In this picture, this baby boy has spina bifida. So, an abnormally high alpha fetoprotein level in the client serum or amniotic fluid suggests a neural tube defect, such as spina bifida. A family history of such defect increase the risks of carrying a fetus with a neural tube defect. Although the low AFP level has been correlated with Down syndrome. So here I want to tell you the alpha fetoprotein. When alpha fetoprotein less than normal, patient develop chance to develop Down syndrome, right? Down syndrome. So when alpha fetoprotein is down, reduce Down syndrome. When alpha fetoprotein is more than normal or high, patient chance to develop neural tube defect. And this neural tube defect is called spina bifida. What next? The client gestational diabetic is poorly controlled throughout her pregnancy. And she goes into labor at 38 weeks and gives birth. Which priority intervention should be included in the care plan for neonate during his first 24 hours? The client has a gestational diabetes. Diabetes developed because of pregnancy and is poorly controlled. She does not she goes into labor 38 weeks and gives a birth. Which priorities intervention should include the care of plan for neonate? Mhm. In that scenario, what is the most important in the first 24 hours? Admin insulin subcutaneously, administer a bolus of glucose IV, provide frequent early feeding with formula, and avoid the feeding. So which is the first priority? If mother has a gestational diabetes and it does not control well. So first priority is provide frequent early feeding with formulas. What are the rationale? That neonate of a mother with gestational diabetics may be slightly hyperglycemic immediately after birth because of high glucose level that cross the placenta from mother to fetus. During pregnancy, the fetal pancreas secrete increased level of insulin. In response to this increased glucose amount that crosses the placenta from the mother. However, during the first 24 hours of life, this combination of high insulin production in the neonate coupled with loss of maternal glucose can cause severe hypoglycemia. Frequent early feeding with formula can provide hypoglycemia. Insulin should not be administered because the neonate of a mother with gestational diabetic is at the risk for hypoglycemia. A bolus of glucose given IV may cause rebound hypoglycemia. If glucose is given IV, it should be administered as a continuous infusion. And oral feeding should not be avoided because of early frequent feeding. So provide frequent early feeding with formula.